right. Good afternoon, everyone. We have a number of updates to share today, and we'll have a comment. Olivia will be coming back on in a moment with a slide deck to lay them all out.
Yes.
Not some weird feedback happening here.
It's not coming through on my end.
I see. Sorry, folks. I think there's something weird going on with my phone here. It's connected to the speaker here. Let me end that. All right, there's a weird. I was hearing myself about 10 seconds ago in the office. It's still happening.
Sorry, everyone. Bear with us as we sort through the technology.
Let's try this again. Olivia, can you hear me all right?
I can, yes.
All right. I apologize, everybody. Let's hope this lasts. So, good afternoon, everyone. We've just begun our 6th month living under a state of emergency that has no modern precedent. Today, I want to share with you my sense of where we stand on our efforts to weather this long storm and to update you on how the city will approach the challenges immediately ahead of us. Our performance to date as a community in this emergency has been outstanding. In March and April, we flattened the curve more rapidly than just about any other community in America, and we've sustained those levels while restarting major sectors of our community for more than 3 months, sustained those very low levels of virus transmission. However, we are now entering a risk period in which our success will be challenged by the reopening of public schools and of our local colleges. In contrast to much of the rest of the country where such reopening cannot currently be done safely, our success in suppressing the virus has earned us the opportunity to attempt to restart these critical sectors of our community. Our children, our parents, our teachers, our students, our mental health, our physical health, and our economy will all benefit greatly if we can achieve this goal safely. To succeed at reopening these sectors, we will need to continue our focus on the 3 interrelated efforts that have made us successful as a community to this point: strong and evolving public health regulations, good coordination between government agencies and key institutions, and most importantly, outstanding vigilance and compliance with public health orders by the people of Burlington and Vermont. To that end, in service of continuing all 3 of those efforts, I'm announcing today the following new preemptive regulations intended to suppress the spread of the virus, and 2, an update on my conversations with UVM. So let me start with the new regulations. Last Friday, the governor, after conversations that we had been having with his team, granted Vermont municipalities new authority to regulate group gatherings and bar operations. And this Thursday, I intend to call a special meeting of the City Council to approve an emergency resolution that will make changes in both of those areas. So first, we will be limiting the maximum size of gatherings on residential properties in Burlington to 25 people. Indoors, the limit in residential buildings in Burlington will be 10 people. With respect to the regulation of alcohol in commercial establishments, we will establish a last call for the sale of alcohol in Burlington at 10 p.m. in all Burlington establishments, bars and restaurants. Let me say a little bit more about why we are taking these steps preemptively before there is a clear sign of virus spread beyond the levels that we have generally seen it at in the last 3 months. Fundamentally, we're making these changes because of a number of factors. One, we want to avoid the backsliding and failed reopenings that we have seen other states and cities experience in this pandemic. Just yesterday, we saw, for example, the University of North Carolina, Chapel Hill make the decision to send thousands of students home just days after reopening. We are hoping there's a way that the city can play a role in avoiding that here. We know we are entering an at-risk period where many people are coming to Burlington from parts of the country that are experiencing currently much higher levels of virus transmission, which is a real change to the general posture we've been in recent months. We know that bars and student parties have contributed substantially to the spread of the virus in other cities, and that's what these new tighter regulations are aimed at. And we know that if we wait for positives to start showing up in the testing, that there is a lag time and that we may have missed our best opportunity to keep the very low levels of virus transmission in this community contained. And finally, we intend these steps to be a reminder to all residents that the threat of the virus remains very real and that college life this fall must be different than it is in normal times. Ultimately, it is up to each of us to do our part to make the reopening successful and keep vulnerable members of our communities safe. In addition to these new rules, we will be taking the following steps to enforce them. Burlington Police will, as soon as this regulation goes into effect, begin to conduct supplemental COVID educational circuits in areas in the neighborhoods surrounding the colleges to inform the residents about these changes, respond to complaints, and if necessary, write civil tickets. We have, in many other areas of the pandemic response, been successful at prioritizing education and engagement over actual ticketing and enforcement steps, but our police will be prepared to write tickets if that is necessary. And as I'll speak to more in a moment, it is our understanding that the consequence for students hosting such parties and receiving such tickets is potentially significant beyond the tickets alone in terms of their standing and status with the college. Secondly, in partnership with senior officials at Champlain College and the University of Vermont, I recently asked the Commissioner of the Department of Liquor and Lottery, Patrick Delaney, to increase the DLL enforcement in downtown Burlington, with a particular focus on the enforcement of the governor's public safety orders during this at-risk period. And it is our understanding that DLL will be increasing its presence during this period. Final point I want to make about these regulations is that it is my hope that they are short-lived. If virus transmission levels in Burlington remain very low after both the public schools have opened and after we've gotten through this transition period of the colleges reopening and getting into the rhythm, their new testing rhythm and new operating rhythms, we will happily reevaluate the necessity of these regulations and consider lifting them or altering them as we get into the latter part of September, early October. We will we'll be evaluating it regularly during that period. The additional points I wanted to hit on this afternoon have to do with updating the public on the conversations that I have been having with the University of Vermont and Champlain College. I want to start by reaffirming my appreciation for those institutions, my recognition of the key role that they play in Burlington, and to say once again that I consider students to be highly valued members of this community. I have long supported the goal of safely reopening in-person learning in our colleges this fall, and I think that remains the right goal. Last week, I shared some questions and concerns that I had about UVM's plans for reopening. I said that I made that communication fully aware that UVM has made a major effort investing massive resources into devising a plan to safely reopen, but I did still have questions and concerns. Since issuing that letter, I've had a one-on-one meeting with President Garamella, and our teams have continued to meet, and I'm pleased to be able to share some updates with respect to the city and UVM's communications. First of all, within the letter that President Garamella sent back to me, it's not really gotten a lot of notice, but I do want to note that he addressed a couple significant points of my initial letter. He explained, as I had requested, why the revised testing protocols met academic standards, academic best practices, and the role that the pre-test that students are being required to take even before returning to Burlington plays in it, and I was satisfied by that explanation. Further, he also articulated that the standard that UVM expects their laboratories to meet is of a 24-hour turnaround for testing results. That is a very high standard. That is a standard that many other testing facilities, of course, are not meeting right now, and that's a problem nationwide. I was reassured by his assurances that that is the standard that UVM is confident that they and their partners are going to continue to meet. So that was in the letter last week, and I just wanted to note that because I thought those were significant points. In addition, the conversations subsequent to President Garamella's letter have yielded areas of agreement in some new areas. One of the areas I was focused on was testing transparency. I was concerned about a system that, as I understood it, was going to release information only once a week and only and not the full information, only the positives, which was going to make it very difficult to evaluate what was happening within this testing. In further conversations with UVM, we've now clarified, and I think the total system is a combination of things that in some I find acceptable and workable. One, the daily results of the test that UVM is conducting are in real time being shared with the Department of Health on a daily basis soon as those results come in, they are shared with the Department of Health, and those test results will be included and are starting to be included, I believe, in the department's aggregate daily reporting. So we all will be able to look at the city dashboard and go to the Chittenden County numbers on the city's dashboard, and you will be able to see the latest with respect to Chittenden County testing, which will include on a daily basis very substantial numbers of tests from the University of Vermont testing. Further, UVM has agreed to add additional information to the reports they are putting out on a weekly basis. So currently, up until now, they've been listing just the number of positives for each different subgroup that they're monitoring: residential students, off-campus students, faculty and staff. They have those 4 different divisions. They are going to add to each one of those rows a new column that shows the total number of tests in each of those areas. And in addition, UVM has made a commitment to brief the city on a weekly basis. Our teams will be meeting, and if there are issues that arise, if there are concerns, there will be more frequent briefings of the city team as needed. And from our experience managing the outbreak that we talked about last week in Winooski and the Old North End in Burlington, we know that that type of coordination and communication is essential, and I'm appreciative that we now have this agreement from UVM and Champlain and the state to be communicating in this way. Let's go to the next point, Olivia. Consequences of missed tests. We did not feel it was clear what the consequences of missed tests would be without the discussions that took place at the end of last week and beginning of this week. UVM has now made it clear that in addition to other consequences for missing 2 tests, students that miss 3 tests will be suspended. The city finds that reassuring. This whole plan for reopening really hinges on the testing protocols happening regularly, the regular tests happening, and that, of course, is premised on students actually taking the tests. And so we appreciate this clarification and commitment by UVM that there will be consequences for students who miss multiple tests. Touched on this a bit already. It is related to the testing transparency. It is about more than simply testing, though, so we have made the point here as well. Senior representatives from the city, state, UVM, and Champlain College have been meeting. There's a commitment to continue to meet in what we're calling this college reopening coordination team. Again, this team will meet at least weekly and more frequently if clusters or outbreaks start to occur. And then finally, and importantly, we are in agreement now with UVM that we will start as soon as this week these educational circuits, COVID educational circuits that I touched on before as an enforcement measure. And UVM, as they have in the past with quality of life patrols, will be financially participating to help the city afford the extra officers that are going to be needed to do these, to take on these additional responsibilities. And these efforts, the quality of life efforts in the past were successful in improving quality of life measurements, but what is really compelling to me at this point is the purpose of this goes beyond quality of life and really now gets down to public health. We know that gatherings don't comply with the governor's orders or with our with the orders that we're expecting the city council to approve on Thursday are matters of public health and potentially life and death. And this is the best system that the city and the college have. It's an existing system. It's the best way that we have to address this public health issue. And I appreciate UVM's, after discussion, that we are in consensus that this is an important strategy for the moment we're in. I think that is basically our summary. I will just add to that beyond the items I've just touched on, the city stands ready to assist UVM, Champlain College, and the state in their reopening efforts in any way we can. We'll be monitoring the situation closely. We will be continuing the other public health efforts that we think will have a positive impact on the trajectory of the virus suppression during this period. The city is going to continue to operate its supportive quarantine program that has assisted more than 300 Burlingtonians in successfully complying with quarantine orders in recent months during the pandemic. We continue to meet with seniors' homes on a weekly basis. We continue to expand our capacity to engage with BIPOC communities and ensure we're doing everything we can identify to protect those vulnerable communities from the virus transmission and spread. The first step in making sure we're protecting those vulnerable communities is making sure that we're continuing the suppression of the general suppression of the virus, continuing the box it in success that we have talked about so many times in the past. And the announcements I'm making today are squarely aimed at continuing that record. With that, I'd be happy to take some questions if there are any.
There are. And reminder for members of the media who are tuning in, you can let me know that you have a question by emailing me at olivia@burlingtonvt.gov, and then I will add you to the queue. So first up, we have Liam Elder Connors from VPR. And hang on. Liam, you should be able to enable your microphone now.
Great. Just wondering, seeing the news about University of North Carolina, Chapel Hill, and their decision to switch to remote after 130 students there tested positive. So it sounds like you're going to be working more closely and meeting with UVM more regularly. So what is the threshold that the city has now for pushing for something like UVM going to remote if you start seeing clusters and potentially an outbreak among students? What is the threshold that you have for when you want UVM to be taking decisive action like that?
Mm-hmm. Yeah, Liam, thanks for the question. And I understand the desire for clarity on thresholds. And at times in this pandemic, the city has been in position of asking the state, for example, for thresholds. And what what has, I think, served Vermont well in the pandemic to date is that the state, the general strategy from the state, which of course is the leading public health agency and really kind of sets the agenda, sets the direction for public health policy, has been to try to avoid attempting to project exactly what the threshold should, to make precise projections on exactly what will trigger events, not because there isn't concern, not because there isn't an intent and desire to take action to respond to circumstances if necessary, but because because outbreaks can take different forms, and because keeping some flexibility in this crisis has served the state well. Let me give you an example about that. So when this outbreak that we've talked about a number of times in Winooski and the Old North End occurred, there was was quite a significant number of people that ultimately were affected. 117 was the final count. There was, if there had been a number established, like just a kind of isolated number that said, if we go over this number, we're going to start shutting down bars and restaurants, say, in Winooski or Burlington, we might well have taken that action. Instead, the state's judgment as those events were continuing to unfold, looking at the outbreak, was that they felt it was still contained. They thought the dimensions of the outbreak were known and could be quickly reined in. And they turned out to be right about that. And they quickly did get everyone tested that needed to be tested and contained the virus, and it did not spread broadly. So I think that same principle, I know it's a long answer, Liam, but I think the same principles at play here, neither UVM or the state has laid out precise thresholds, because I think it's going to be more complicated than that. I think it's going to be looking at a number, it's going to be looking at trends, and it's going to be looking at a number of different metrics. I think they are the metrics that you see on the state's webpage, the metrics you see measured, for example, on the COVID Act Now page. And if we start to see a problem, there's going to be a lot of analysis of those metrics, and there's going to be kind of a holistic conclusion as to whether things have gotten so bad that some kind of dramatic action, like UNC Chapel Hill needs to take, will be taken. What's
so bad? I mean, I think that's the question. I mean, I've been hearing a lot, not just from city councilors at a press conference last week, but also from community members talking about this. And I think there's just a general sense on, yes, maybe there's not a specific number you can give, but like some more clear sense of like what is the worst sort of situation, or like how is the city and UVM, like how are you working together to plan for that sort of thing and address it? Because I think it's unclear, and like the long answer you're giving, it can be a little hard to follow and understand exactly how you're thinking about these situations and what plans are in place.
Yeah. To boil that down, Liam, I will be looking for evidence, and I want to be clear, the city has a limited role in this, but for public health reasons. We do not, we see the public data with respect to numbers. We do not, and we do get these supplemental briefings from the Department of Health, and now UVM has committed to them as well. But the city is not well positioned to be the prime decision maker in a situation like that. What I will be watching for from our limited vantage point is, if there are positives, does this outbreak seem to be defined? Are the edges of it well known? Is it spreading in ways that are unanticipated and out of control? And that, I think, is going to be the key. And we will all be watching. We will see that in the raw numbers with respect to the total number of infections, the infection rate, the trends on those numbers, which are well mapped out in a variety of sources now. And it will also have qualitative information involved in it. Where are these outbreaks occurring? Are they in a physically isolated area, or are they cropping up in numerous locations? Those are the type of factors that I'm going to be looking for, and that's my sense from having worked with Dr. Levine and his team now for some time, that the state, as ultimately the public health agency really in charge, will also be, we'll be looking at with considerably more information than the city has and than the public has.
Thank you.
Next question is from Derek Brower at 7 Days. Derek, you should be able to enable your microphone now.
Yeah, hi, Moreau. I have two questions for you. The first is just to be clear, does UVM have a green light from you to carry on with its reopening plan in light of this information you've received?
So Derek, listen, I've been clear. I think the goal is the right one. I think it's really important to reopen in-person learning if we can. I think it's important for that whole host of reasons I listed at the top of my remarks. I continue to share the goal. It's clear to me that UVM has made major investments in staff time and resources in standing up a very comprehensive and thoughtful plan. And further, I can now say in a way that I couldn't a week ago that I appreciate that in response to city questions and focus, they have made some important further moves that address the top priorities that I listed in that letter. You know, at the same time, certainly we are in uncertain and unprecedented times, and we can't say definitively what the future holds. I certainly hope that UVM will be successful at this, and if there's any place in the country that can be successful at this plan, I think the combination of the very low levels of virus circulation in Burlington combined with a well-resourced plan give us a chance to succeed where others have failed, and I'm hopeful they will succeed.
Thanks. And my second question is, why could you explain why the city is using armed officers for these educational circuits in light of the discussions the city's been having about policing in recent months and and the tendency for use of force incidents to occur most often and late at night with intoxicated individuals?
Yep, I understand that concern, and we did with UVM, both of us internally and together, evaluate, consider many other options. Ultimately, what we returned to was that this is an existing system that has done comparable work with respect to the quality of life patrols. It's different. I do think it's important to point out that this is, you know, the reason we're doing this is because this is a public health matter, and this is it is a high community priority, I believe, to make sure that we do everything we can to keep this community safe from coronavirus. So it's a high priority. We have officers who are well trained and experienced at performing comparable duties. They have conducted these types of circuits for more than 8 years without an incident that I am aware of. Literally, I am not aware of prior complaints about how they conducted themselves in doing this work. And the alternatives we couldn't find an alternative that was better. We had, in fact, concerns that some of the other options one could imagine would actually increase the likelihood of some kind of problematic situation arising, either because people were not trained and we could put people in people who are attempting to enforce these roles in challenging situations for themselves, or the opposite, that we use that other types of personnel that could be exercised would not be as good and sensitive and tactful as the Burlington police have shown themselves to be in conducting this kind of work. So we return to the solution we had for the moment. It's not to say in the future that this work will necessarily continue. This is in no way a step away from the broader reevaluation of policing and commitment that I've made and that's made in my budget to try to transform policing and look for ways that we can substitute other types of professionals for armed officers in the future. We didn't see a way to do that on this timeline here.
Last thing, how much is UVM paying to offset the cost of this?
The costs have run approximately $10,000 to $15,000 a month in past years when when these types of activities are happening at kind of full strength, and often in past years after an initial surge of interest and need, that has reduced over time. So that's basically the cost. 10 to 15,000 is what we expect it to be if there is a kind of full month's worth of need here.
Thanks.
Great.
The next question is from Lauren Granada from NBC5. Lauren, you should be able to enable your microphone.
Hi, Mayor Weinberger.
Hello.
So I have two questions. What do the educational circuits entail exactly? And how big of a role do community members play in keeping students accountable as far as the ticket issuing goes? How big of a role do community members play in that?
Okay. What I expect our officers to be doing is to be during evening hours, late night hours, early morning hours, to be walking the neighborhoods that are known to be impacted by these type of events proactively, where they see gatherings that are at risk of not complying with the size limits that I discussed earlier today. They will engage people, make sure that the people in question understand what the rules are. If there is clearly willful compliance, they have the authority to issue tickets. Right? That's the activity we expect the officers to play. What role does the community play? The public frequently does report non-complying events or events that are problematic with other rules that Burlington has on the books. And so in addition to the proactive work that I just described, these officers may well be responding to complaints if people have such complaints. So people can make complaints in a variety of ways. They can do so by calling the police department. UVM also, I believe, has just issued a new form through its kind of neighborhood relations division of the administration, where they are inviting people to report incidents by filling out a form as well. What the educational patrols give us the opportunity to do that without them, we wouldn't have a good mechanism for doing consistently, is to respond in real time to the public if there are complaints. That is certainly one of the things that I'm hearing from our constituents is there's a strong need for. We need this type of capacity if we're going to respond to those kind of complaints, and this will give us that ability.
And I believe that's all the questions that we have for members of the media.
Okay, very good. Thank you, everyone, for joining us today. And I do anticipate that we will share. We'll be warning the meeting for Thursday at some point tomorrow, and the regulations I talked about today will be issued in a formal emergency resolution that will be posted in advance of that meeting. But we expect it to have the content I described earlier. Thank you all for joining us. We will see you again soon. Take care.